It's Julie Damp. I'm a mom. I have a daughter who is starting college in like 3 weeks myself, and so here more as a participant than anything. We have several of our panelists you guys met in the prior session who are going to be here, and hopefully, I mean, for me personally, this is an opportunity to ask questions without my daughter telling me like how incredibly lame I am. So you guys can feel free to ask those questions, and then hopefully you've freed up your kids a little bit for some space away from us too to ask questions that they would want to ask. So anybody in the room want to start us off? All right. So just to repeat the question so everybody, make sure everybody can hear. So the question is, and correct me if I got this wrong, someone who has an established provider, psychiatrist provider here going away who wants to find a different person rather than just using the stable, established relationship? Oh, the doctor wants her to find someone else. Okay.
Hello. So I think that this is something that comes up a lot. I think it depends on the specific situation, like if they've been on a medication for a long period of time and they're stable, or they're in the process of making like a lot of active modifications to their regimen. But typically, even on telehealth, the physician needs to have, if the patient is in a certain state, they need to have a license in that state. And so, like, for example, I'm licensed in a few different states, which can be helpful for this reason. But if that physician is not, it sort of limits their ability to actually legally see the patient. And so that might be, maybe I don't know, but maybe making changes. Or what I usually say to folks is if they're on a stable regimen, and we have good rapport and, you know, we're not making a lot of changes, I usually advocate for like learning about what is available at their counseling center in terms of like therapy and optimizing their resources. And I'm more than happy to schedule when they come back on breaks, when they're in the state, on telehealth or in person. Or if I happen to have a license in one of the other states, I'm happy to see them while they're there. But I think maybe that could be part of that reason that's contributing. And then if it's more acute, sometimes we'll do that over the summer or like over the school year. We'll switch and then you can come back afterwards. Yeah, great question.
Other questions? As you guys are thinking up, so I will ask one that I have. So I'm anticipating getting calls from my daughter where she's having a bad day, things aren't going the way you want them to go. And, you know, I know part of my responsibility is to let her become more independent and to grow a little bit away from me, you know, being able to deal with all her problems on a daily basis. So what are some red flags that we should look for from our kids as, you know, when they make those phone calls?
I think, yeah, that brings up a great point, especially in terms of like feelings of sadness, which, you know, are normal, right, in the context of a breakup or a failed exam, versus when is it more like persistent and like functionally impairing or affecting their day-to-day. So I think like if you're seeing, you know, they're isolating more, they're not doing the things they enjoy, they're expressing that they're not enjoying like their sports or their activities or clubs that they once did, potentially like starting to use substances more heavily, not motivated to go to classes, or skipping a lot of coursework or exams, or failing a lot of tests despite trying or despite usually being pretty motivated. And then, you know, maybe having difficulty with sleep or appetite. Those like associated things are really when I start to wonder. And also if it persists for especially like 2 weeks or more. So it's not just, you know, period of time during the day with other changes in mood, but really is persistent and pretty debilitating.
And I would like to add, just always continue to create a safe space where you're not judgmental. You can be open and empathetic about what they're going through, and also normalize mental health. There's help out there on college campus. As I like to say, student affairs is pretty much your student affairs. It handles all of your students' needs, from medical to counseling, even to disabilities. And a disability is not really, not saying it's not diagnosable, but an IEP plan or a 504 plan can also be transferred over. But just listening and really encouraging that you do have support. And as a parent, you know, we kind of take those few steps ahead. It's okay to identify those resources and help them take care of some of those small tasks if you identify those signs and symptoms are becoming overwhelming and they're more persistent. Taking a little bit off their plate is not. They may say they're independent, they want all of this and do things on their own, but they do want someone to come in and support them and help them. But if you're being judgmental and always trying to fix it, sometimes, when they're trying to gain those independent skills, they will kind of step back because they are trying to learn independent skills and figure out who they are. But the most thing as a parent is just stay supportive, be empathetic, non-judgmental, and make sure that you are normalizing. It's okay for ask to help, and this is also normal.
Did you have anything?
I think when you talk to the kids, I see a lot of parents of kids who are middle school and high school. The kids will say something and the parents will immediately go to fix it. But just kind of pretending like you're a psychiatrist, just have open-ended things and let them spin out. And if they're still spinning at the end of it and you can just feel that building up, then you need to probably do something about it. But if you feel like all the air's gone out of the balloon, they just wanted to check in with you, then that's probably fine. Again, they're supposed to struggle, but they're not supposed to suffer.
Other questions? Yeah.
Well, we all know as adults, our plans sometimes change. And I think sometimes in this young adult stage is that they are learning and trying to figure out who they are, who they want to be, and how to get there. Again, creating a safe space for them to be open to share and come to you is always good. But also do your own research. I like reverse psychology with my own children or whatnot. I may not have all the answers, but I know enough information to lead, and guide them without it coming from me. I know her, so I'm going to just kind of use us as an example. The other day when she actually expressed this comment, to me, I told her she's going into nursing and she's in a 2-year college. And one of my advice to her was maybe think about the colleges she want to go to for a 4-year college. Look into their nursing program, and then you go back and ask her, what are your goals? What are your plans? You having a foot ahead of knowing what the expectations may be for those programs, you can just guide her without telling her, well, University of Memphis has A, B, C, or D. UTK has A, B, C, or D. You already know what it is, but you can guide her to, well, maybe check onto this website. Maybe contact the director of nursing or the dean of social work or whatever that department. Because honestly, on college campus, they do like parents to call and inquire and ask questions, just like in middle school and high school. But parents, we sometimes don't realize that we have that autonomy because we're giving them that independence. Working at a university counseling center, I had more calls from parents like, hey, my son or daughter reached out to me because they had a bad relationship or a bad night. Can you do a wellness check? And I will just go into the computer, figure out what dorm they are, and contact the resident's life, and I will just actually go do a wellness check. And it's like, hey, your mom called, and she's worried about you. And they're like, oh, my gosh, I just broke up with my boyfriend, and blase, blase. And I'm like, yeah, that happens. But, as a mom myself, you need a hug. Because sometimes I learned they just need that little small physical touch and a little likeness of a nurturer parent. And they actually feel pretty good. And then I can call that parent with their permission to say, well, I gave your kid a hug if that's okay. And they're actually doing okay. Or they actually are coming into the counseling center to actually have the conversation. And again, this is all with their permission. Sometimes they're not giving me the formal consent because they are, adults. But sometimes I have my work phone with me and it's like, can I call your mom right now? Because as a mom, I would go crazy if I sent someone out to speak to my kid and I'm waiting for hours trying to respond back. So again, I think, for me, to anyone, is just try to be a few steps ahead, but at the same time, let them guide you and where they're going, and you just support them within their plans.
I think you did a great job.
All right. More questions? Yeah. So just to repeat that question, but looking for kind of talking points and ways you discuss overuse in alcohol, substances, social media, things that might tend to cause them to kind of spiral into unhealthy things without being super overbearing.
One thing I do with my patients when they go into high school is I do a genogram and try to show them, we'll talk about addiction and say that it's got a genetic component. And if you have it on both sides in your family, a general risk is like 1 out of 10. If you have a first-degree relative, it doubles to 1 out of 5. And just to let them see, if you've got a huge family on both sides and nobody has a problem, then you probably aren't going to be genetically loaded for that. But if it is on either side, and it's a great time to talk about this, because 1 out of 6 kids I see has a close family relative who has a problem with drugs or alcohol. I mean, it's just really, really common. So people are hopefully not hiding it that much anymore. And I tell the patients I want them to have a great time with alcohol if they choose to. When they get older, I want them to have margaritas on the beach with their girlfriends or beer at the ball games. But if you're genetically loaded and you burn it out early, you've got to stop. And then you're the one going, could I have a Diet Coke, please? And, I think that's important to talk to it just from a medical point of view. And then I would just ask more questions, and if you have any cool people in your family who are younger, like if you have some nieces or nephews who have just been in college, they'll listen to them, and they'll listen to their older siblings in a way more than they listen to us. And don't teach them how to drink at home, because you do that, they're just going out and drinking again somewhere else. It's ridiculous. But
I will also just have questions about boundaries, like character building. Who are you? Who do you want to be? Like, what are your non-negotiables? I mean, those things that, really help them to kind of really weigh in on their inner self and where they're trying to go. Because, as you're guiding them, you can use their own character to kind of help them towards making a better decision. But if they don't know what their boundaries are, if they don't know what their non-negotiables are, you can't really teach them what they are. But we also have to model as parents what our boundaries. Even when we do have, gatherings at home, are we overly indulging, or are we learning how to stop and say, you know what, I maybe had two drinks tonight, that's my limit, and those are just practical conversations that you have at home within your own family dynamics. But just asking them, what are your boundaries? Like, what if, you're at a party? And I don't think it's nothing wrong. I know one thing that my mom always told me, if you drink, do not put your drink down, and if you put a drink down unattended, go get another one. And that just always stuck, with me. And then I've always asked, my college students is, what is your support group? Not your mama, not your church, not your high school friends, but who are your people here? Do you trust them? Because a lot of times in building relationships in college is that you're connecting with like-minded people, but that doesn't mean they're good people, because they're trying to make a connection. And sometimes they don't identify the signs and symptoms. They may think binge drinking is cool because they're a part of sorority or a fraternity or this clique. So they don't recognize that, you may actually have water in your cup and not actually vodka. You may have been given a beer, but that doesn't mean you have to drink, the beer. And that's also learning self-control. And I think, again, having those conversations is a lot easier to do at home before they get out there, because once they get out there, it's just like the neuroplasticity. If you are gaining those skills early enough, it's going to naturally come to you when you're put into those situations.
Thank you. I'll just add too, I think some of what you said is so helpful too for social anxiety, and I see that come up a lot as people transition to school. And I think if they do have a therapist or psychiatrist, that they can talk about optimizing their coping skills before, so they're not, using alcohol to treat anxiety in those moments when they go to parties, can be really beneficial. And, a lot of us will role play with them, will come up and try different techniques, and so they feel equipped and have a toolbox so that when they do go off to college or while they're at college, they feel like they have other options. And so I think that is really helpful, at least for a lot of the young adults that I've seen. We have a plan going into it, and that takes off some of that anxiety and at least takes out the self-treatment aspect of using alcohol, cannabis, things like that. So what I would say is a lot of the teens I see, what we'll do is I do a lot of exposure-based therapeutic interventions with med management, and so often we'll have very discrete, small steps towards that goal that are supported, time limited, and help them eventually reach their ultimate goal of being able to do all of it independently. And so if they're already plugged in, that could be something to bring up with their therapist or psychiatrist, because we do this often. But basically that exposure to those kinds of activities, like at this age, in a more limited sense, is going to help build that independence and lessen that anxiety so that they can eventually like do more of those things independently. And so I think it's hard as a parent, right? Like to tell you that line. But I think helping to support and foster some of those kinds of interactions now is going to be really helpful for when she does transition to college. Like maybe you start, depending on the situation, is maybe you write the email while you're sitting next to her the first time. And then the next time maybe you, and like maybe that time you help edit it. But then the next time she writes it with you there, but you don't edit it just for support. And then the next time, like, you don't edit it, right? And then slowly sort of work your way up. And we know that by doing that, it's like riding a bike. It just gets easier and easier and easier. And so then when she sort of goes, she'll have that practice and feel supported. Yeah. Of course.
So I think we have probably time for one more question. Yeah.
I feel like, there's a lot, it's, your son best, right? And so like there's so much value in whenever I talk to parents about similar things, like what approach you think would be most helpful for him. And I feel like, at least from like a psychiatric perspective, what can be really useful is sort of similar to like starting to support that transition. So like maybe starting to like help, foster like other interests. So he maybe is more motivated to decrease that frequency on his own. And then also to like helping maybe to support some of those boundaries at home to help prepare him eventually so he's more used to it. Because I think what I see a lot of times, sometimes is when people go to college and they don't have that sort of limit before, and they have so much more autonomy now, sometimes it can be really challenging. So I think you are doing such a great job thinking about how to help support him before then and taking some of those steps now, in a way that he would feel supported, I think is a great idea.
And I would also just kind of dive a little bit deeper and just having more communication. Is this more of a social thing you enjoy? This is like your hobby? Is it a coping? I do find with a lot of young boys, they find like gaming is like a coping skill because they're not verbal individuals. They're not the girls who's like, I'm mad, my feelings are hurt, I'm sad. They are the ones who really connect better with gaming because that kind of matches their personality. And also having, measuring to see how focused he is with the work that he's doing. Is he able to complete the assignment? Is he meeting the expectations of those assignments? And, sometimes it's like I tell my parents, I play games with some of my clients because it helps me to gain better insight into who they are and what they're kind of getting from the game. Outside of me always thinking, get off the game, you have a time limit, because I have a son who plays the game all the time. And when I probe too much, he just finds a way to kind of continue. But I also know he's like Mom, and it's like my coping skill. It helps me to relax. It helps me to kind of stay engaged. And he's not assertive. He's very quiet, and he's to himself. So for me, it's like, well, maybe he's building social skills, maybe not. But he's also meeting his expectations, his chores at home. He's meeting his grades expectations at school. He does have healthy relationships outside of the game. So I do know I don't like the gaming and it's time constraint, but I think just kind of measuring and having more conversations to kind of figure out how is this game, enhancing or not enhancing his life, and how it's going to probably trigger his potential goals in the future.
Okay, so I want to make sure we get everybody back in time. So we're going to walk back the way we came to the main room, and just to highlight that the young woman who has Spiky is in the hallway out there, as well as some information about medical power of attorney and that sort of thing, if you have questions about how to do that with your kids.
Can I say that really quick? I know for me, working in the University Counseling Center, I've had a lot of students who's been in engineering, nursing, and medical programs that have had psychotic breakdowns, which is normal in college to go through a lot of psychosis. I would suggest talking to the attorney about a medical power of attorney, because the hardest thing is when I take a child, because I have transported youth to the hospital, and I walk in because I'm coming in as a campus representative, but at the same time, I really don't have a lot of rights to communicate with the parents. Yes, I am going to call and let you know that your child is in the hospital, but once they go into the medical and they are medically released and transferred to to psychiatric, it limits me. At my college university, our psychiatrist worked at the hospital, so when we had any students go to that hospital, he made sure that we did a follow-up once they returned back to school. But many students don't get follow-ups, and a lot of times colleges are not even aware that they've had any psychotic breakdowns or whatnot. So I would say, once I learned about the power of attorney for medical, I think it's a great way for parents to still be engaged and still have that autonomy to make those medical decisions, because they can't make some of those decisions when they're having a psychotic breakdown when they don't even know their name, their address, or who they are. So really take time to really explore that.
And I would say, just as a practical add to that, you can, when you know where your kid is going to school, you can get on their HIPAA release at the medical center where they would be going to. And if you do that proactively, then you're already someone that the physicians can talk to.